Okay, so this is week 2 of terminology review and preview. So we're going to go over kind of the entire shebang here. Just as a quick reminder, we will have a Zoom this week at some point. So keep an eye open for that in the discussion, or actually in the announcements and in your emails, which I will contact everybody here and there for those. And I try to do the announcements on that as well. The announcements is kind of the easiest way to get the whole class information, of course, and the rest of it would be for, I may say, hey, I have to change something, but all the Zoom meetings and stuff like that will not only be on the Zoom tab on the left side of your screen, but it'll also be in the announcements. I'll have a link, and we should be able to get on those. Now, really be conscious of the time zones, because always I am doing everything on my time zone, and then we schedule it. You guys got to figure out where you're at, because I don't know where you're at, right? So remember, discussion post is due by Wednesdays. 2 responses, make sure you do your 2 responses with full sentences to other students by Sunday. Online lab and quizzes are all due on Sunday, and we'll go from there. So here we are. This next one, I think, was muscular, skeletal, and integumentary system, which is, integumentary system, think of integrity. Integrity keeps things where they are, right? That's making sure things are how they should be, which is all the stuff on the outside of your body on the outside, all the stuff on the inside of the body on the inside, which is what we like. We like to keep, let's see, is this going to let me do this? For integumentary system, yay, good. Anatomy and physiology of this, the integumentary system, there are 3 layers. Number 1 layer, the outside, epi, which means top. Epidermis, derma means covering. So it's epidermis, and then you have the dermis is underneath it, and then you have the hypo, which means below, or lower, basically, dermis. So we have the epidermis, which has hair follicles and sweat glands coming out of it, but it's really pretty thin. It's got 5 other layers in it, which we don't really need to learn. But there's a stratum corneum, there's stratum, which means striations, which is like layers. There's different layers, and there's the stratum basale, which is the base, and then you have the spinosum, the corneum, and all that jazz. Okay, so then in the dermis is where everything is. So if you're ever taking anatomy classes later, which you will, you're going to find that the dermis is where your sebaceous glands are, which are the oil glands, where your eccrine sweat glands are, where your hair follicles are, where the nerve endings are, where all of the stuff is, the vessels and all of the lymph tissue and all that kind of stuff is all in the dermis and hypodermis. Okay, now we know the word hypodermic because we put needles in there. Hypodermis goes underneath the skin. Skin layers, accessory structures are going to be things like your nails, okay, and hair, which is a protein. They're all keratinized. Keratin is a kind of protein that actually waterproofs the whole system. So as cells grow and they go up those little layers we talked about, the stratum, the strata, so stratum is one and strata are many. And so the strata, the cells slowly die off, basically. They lose their nucleus. So the nucleus is the kind of like the main computer there where they hold the genetic material, and that's how they build proteins. Well, they can't do that anymore. So what they do is they build a protein called keratin, and that keratin keratinizes the skin. And when the skin's that way, it's waterproof, basically. Okay? And at the end here, it looks like, oh, you get a nice adaptive learning quiz. That's always fun, too. Pathologic conditions, oh, these are fun. This will be a lot more fun, I think. Pathological stuff, the stuff that goes wrong with your skin. So dermatitis, dermatosis. Dermatologist is one who studies and why am I blocked? For some reason I get blocked on that one. So accessory structures, let's see, skin layers. Do we have accessory? Can we do, oh, here we go, skin nails. Speak and spell, so you have the listen and spell, word chop, listen and choose. Okay, this is good. Pathologic conditions. Primary lesions, blood associated inflammation. So blood association, we're probably going to get into things like hematomas. Hematoma is a very important word. Hema means blood. Toma. Whenever you see toma, it means like tumor or space. Something's filling a space. Okay, that's what it really means. And you can have different kinds of hematoma. So if you have a dermal hematoma, that's the skin. A subdermal would be below the skin. But a subdural has to do with brain tissue. Okay, there's some coverings of the brain called the dura, the pia, and the arachnoid. Subdural hematoma, epidural hematoma are actually medical emergencies. Okay, telangiectasia. I get that one messed up. Some of these words are really hard. Imagine if you were like, English isn't your usual language. It's much, much harder, right? Hematoma, blood associated. So it should go into all of those for you. Secondary lesions. What do we have here? Keloid scars. Kind of scars. Lichenification. Lichen is like like moss, basically, is what they're thinking. It kind of looks like a scaly kind of thing, okay? Ulcers, okay, fissures. Fissures is good to understand. So now you guys, especially because you're starting out with this, is learning this activity sequencing decubitus ulcer development. Very, very important, because that's going to show you not only the different stages of bed sores, which is what they're called, but decubitus ulcers is very important. They usually happen on bony surfaces, so like elbows and hips and knees, and back and stuff like that. Shoulder blades, very common. This is why people who are bedridden have to be moved all the time, okay? Inflammation, bacterial infections. Gosh, there's so much in here, isn't there? Inflammation, dermatitis, eczema, cellulitis, folliculitis. This is good. Peruncia. Fungal infection, candidiasis, and tinea. Tinea has to do with the hair, so it's the thing. There's a hair fungus, and then it starts falling out. That's usually kind of a bad part of your immune system. You want to like get things fixed on those for sure. Sebaceous glands, verruca, wart. So if you ever watched Charlie and the Chocolate Factory, there's Verruca is the girl's name. Her name is Wart. That's terrible. Scaling. Psoriasis, corns, calluses, xeroderma, ichthyosis. Ichthy means fish, so it's like fish skin. Okay, pigmentation, we have sweating disorders. Pigmentation disorders are probably going to be like, albinism. Okay, albino means without color. And why did that open up in a total thing? Melasma, skin on the hyperpigmentation. So hyperpigmentation usually happens in through here. Okay, maybe on the forehead. More common in females. Diagnostic. Building your word bank. Okay, the word bank I love. I really like the word bank in here. And applications, case studies. So let's go back into here. Week 2 interactive lecture. We just did that. So musculoskeletal is going to be the same kind of thing. We're going to go over. Where did it go? Previous. Let's go over that one right now real quick. And deed. I do not like the way this opens. It's kind of a pain. Close all this. There we go. Okay, anatomy and physiology. It's going to go over the framework and functions of bones. The function, so it's going to always talk about the function. The form and the function is what we talk about in anatomy. The function then is broken down into the physiology, right, and the basically. Well, how would you say it? Physiology is like usually either gross physiology or microscopic physiology, which is mostly going to be chemistry anyway. Chemistry and electricity is the way the body works. Composition of bone processes, depressions, axial skeleton, the face and the skull. This is all basic anatomy and physiology. Let's see what we got here. And it have different, all kinds of fun stuff to go through. There's quite a bit in here, isn't there? So bone marrow. So the thing with bones, let's see if I have one. There we go. I have one over here. Thing with bones real quick. Basic bones come in different shapes and sizes. As we can see, there's long bones and there's really short bones. And then there's these little weird short bones in here and some irregular bones. There's many different shapes of bones. We have flat bones even. And we have flat and long and irregular and I can't remember. I think that's it. Flat, long, irregular, and short and long, whatever. So a long bone has some definitive points on the ends. Are called the epiphyses. Epiphyses, both sides. Now, this is a humerus. It's not that funny, really, but this is the right side humerus. 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 It goes here, right in the arm. This is the head of the humerus. This is the proximal towards the body epiphysis. This is the distal epiphysis. Distal. It doesn't matter. This one is, no matter which way it is, that's distal. This is the diaphysis, or diaphyses. The diaphysis, many diaphyses, the diaphyses of the bones. Okay, that's the plural. Inside here, if we cut this way, a transverse cut, remember it goes like this. This is transverse, this is sagittal. If we turn it on its side, this way, that would be coronal. Transverse cut, we open it up and look at it, it's going to be like a little donut. And in the middle of that is marrow. We have two different kinds of marrow. We have red marrow, which holds up in the ends of the bones, called the epiphyses. And then we have in the spongy bone, actually. And then we have this, which is called compact bone, or cancellous bone. This through here inside is yellow marrow. Yellow marrow is fat tissue, and it's usually for storage. Now, there are different layers on the covering of the bones. Is called peri, which means around, osteum, bone. The stuff around the bone, periosteum. See, the weird thing you're starting to see with this terminology is you're starting to see it as a language, and it's just using another language to name things, which isn't really helpful. I mean, why don't we just call it, there's a covering of the bone, but then we had to name it, the covering of the bone is called basically the covering of the bone. That's what we just did. We just took a Latin word, Greek and Latin, and we defined something and then said the same exact thing in English. So we're double speaking all the time with anatomy and physiology, which makes it kind of fun because you're like saying twice as much. You really don't need to. You could just say the periosteum, because now you know the periosteum is a covering of the bone. Periosteum has a lot of nerve cells. If you break a bone, if you've ever broken a bone, you're going to feel like a lot of pain in that area, and that's because that has been torn or disrupted. Okay, bone processes and depressions. Oh, so we have all these processes. A process is something that pokes off it, right? Or depression, like in here. These are called fossa or fossae. Okay, and then we have grooves, and we have ridges, and we have crests, and we have tubercles, and we have heads. Like here, this is the head of the humerus, those kind of things, and we have a greater and lesser tubercle in here. Tuber comes from the word from potatoes, right? So it looks like a lump. It's a lumpy thing like a potato. That's all it means. So there's many different ones of those. Tuberosities, trochanters. You have a trochanter on the hip, tubercles and condyles. Sinus. Sinus is an open space. The skull has many fossa and foramen. So if we take this, which never comes off. So I got to get the skull to come off to show you later. I don't have another one. I don't know where it went. I have some somewhere. I don't know where it is. Anyway, there's fossa, okay, which are holes and foramen. Okay, the external auditory meatus is another word for foramen. Okay, a hole. Okay, there's the foramen on the bottom of the skull, the foramen magnum, the big frame, the big hole, basically. Okay, you'll go through those. That's really good. Face and skull, spine and rib cage, face and skull. Okay, so let me see if I can just bring this up here, and we can talk a little bit about this. The facial bones. Now, so there's some main bones we have to know. Frontal on the front. The back one is called occipital. Occipital. Okay. This one on here, parietal, which means wall. It's on the sides. Parietal walls, right? This, if you can see, I don't think you can see that, but there's a suture there. This is a stitching together of those bones, the two parietal bones and the frontal bone here. This is called the bregma. This is called the sagittal suture. This is the coronal suture. Coronal cut, sagittal cut, right? As we turn the head to the side, we're going to have frontal bone here in the front, nasal bones over here on the side. Let's see if we can get up in here. This one, this is one of my favorites. This guy here is called the Zygomaticus. Okay, this is the maxilla right in the front, and then we have the mandible. That's this guy here. Now down here we have temporalis, right? And then this thing here is called the my brain just went blank, and I don't remember. Oh, the mastoid process. Sorry, there's the external auditory meatus, and this is the cervical spine. So as we go through these fun and dandy little bits of the skull, we get to see different parts of everything as we go on. So now, appendicular skeleton. The axial skeleton includes this, okay, the spine. It includes rib cage, the neck, and the skull. It does not include the shoulder blades, but it does include the pelvis. Okay, Does not include the shoulder or the shoulder blades. These are called appendicular skeletons. These are the appendixes, right? The side stuff. We have clavicle, which is collarbone. Back here we have scapula, which is shoulder blade. We have humerus down through here. And then we have the ulna and the radius. The ulna is your elbow, right? And the radius is the one that moves around it. And then we have carpals here in the wrists. And then we have metacarpals here, which are like other carpals, basically, or next to carpals. And then we have phalanges. Okay, remember phalanges. Phalanges, here they are. There's metacarpals, there are 5. Phalanges, there are 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Each hand, right? So when you're looking at how many bones there are, you're like, oh my God, there's 206 bones in the human body. I'm never going to remember them all. 54 of them are toes and fingers. See, 14 and 14 is 28. 28 is 8 and 8 is 16, 56. That's 56 total bones. You have 56 total bones in each of these, right? So that's almost a third, well, wait, nearly, a quarter of your bones in your body are fingers and toes. And then you have the metacarpals and metatarsals, the feet, which there's 5 of each of those, 5, 10, 15, 20. That's another 20. And then we have carpals and tarsals, and then we have legs, which are 3 bones. You have the 3-4 bones, actually. If we look here, there's the tibia, the fibula, not fibia, fibula, patella, and this is the femur. So femur, 1, 2, 3, 4, if you include the patella. Patella is what's called a sesamoid bone or sesame seed-shaped bone. It's kind of a cool one. Okay, so there we go. That's the basics of the skeletal system. Then we have the pelvis, we have lumbar. The way to remember the spine is at 7 a.m. you should have breakfast, which is the 7 cervical vertebra. There are 7 in the neck. And then at noon you have lunch. That's the 12 in the thoracics. That's here. And then 5, you should have your dinner, which is the 5 lumbar. And there you go. So the rest is, you just got to remember. Okay, let's see. Pathologic conditions of bones, congenital deformities. There's a lot of cool, not cool ones. There's scoliosis, lordosis, kyphosis. You can have things like other congenital and genetic deformities such as ankylosing spondylitis or there's let's see, bone injuries. I'm trying to think of a good one, one that was in another case that I had. Can't remember right now, but I'll remember and I'll get back to you on that one. Building your word bank, all that kind of stuff. Very good. So there we go. That's our whole week there. Week 2 lecture. What's going on? Week 2 reading. It's going to tell you to read the whole thing that we just read, which is fine. What's this? It gives you the whole textbook. And this is what your discussion. So you're working in a large multi-specialty practice when you and one other person share the responsibility of scheduling necessary diagnostic tests and surgical procedures for patients. You're preparing to send diagnostic test requests to the hospital, and you notice that a coworker has written a diagnosis of fractured clavicle on a request for an x-ray of the small intestine. Explain what a fractured clavicle is. So you get to look at what that is. What's a fracture and what's a clavicle? Describe how sending this test request as it is might affect the patient. Well, there's a lot of ways. If I sent you for the wrong test, you'd be confused. Explain how being familiar with medical terminology could improve your job performance in the healthcare field. Very good. This is an easy one. Make sure that you answer those 3 points in there, because that's what we're being graded on. And then make sure you go back and look at other people's responses and answer 1 or 2 of those. Okay, it says meaningful responses to at least 2 of your peers. So you need at least 2, guys. And they have to be more than 1 sentence. So 2 sentences, that's 4 whole sentences. You can do this. Okay, instructor section, we'll do that one later because we'll go over some other stuff. And case study 3 and case study 4. Whatever, yeah, 3 and 4. This is, what are we doing? Week 2. Oh, that's week 2. All right, here we go. Case study. Preview. Okay, those are both quizzes, which is no big deal. So go to the quiz and nails look funny. She's worried. Okay, 4-4. First one. Okay, you can look those up. That's pretty easy. Disease oncholysis, onchiopathy. Remember, disease process means pathology or pathy. Okay, infection, itis. Okay, uh, medical term, or it could be osis, but usually you'd have to look those up. Okay, very good. The other one here, 84-year-old woman who exhibits back pain and a cut on her head when in an emergency department, so she probably fell. Says she has weak bones. Weak bones could be osteoporosis or osteomalacia, is weakness and softening of the bones that cause pathological fractures, maybe. And sometimes pathological fractures, though, we're considering those from cancer, okay, malignant tumors and stuff like that. Anyway, this is Dr. Sean over at your school stuff. So let's go through the last bits here. I think, what else do we have? Case study, bum, bum, bum. Getting the last bit here, case study 4. Okay, that's another quiz. And then you have the quiz, right? The graded quiz. And that's going to be 10 questions. I will try to make each of the quizzes 2 chances. That should help you, I think. And we'll go from there. Okay? You guys take care. We'll talk to you on the flip side. And don't forget to do your homework and turn everything in. Let's get it done. Bye.